afternoon and welcome. My name is Monica Murray, and I am the Public Programming Officer at the New York City Department of Records and Information Services, also known as DORIS. DORIS houses the city's municipal archives and library and is focused on fostering civic life by preserving and providing access to the historical and contemporary records of the New York City government and its people. Thank you for joining us for this month's Lunch and Learn. I'll quickly introduce today's speaker and then pass it to him to begin the presentation. Robert Snyder is the Manhattan Borough Historian and Professor Emeritus of American Studies and Journalism at Rutgers University. In a career devoted to writing and teaching about the history of New York City, he was a fellow of the Smithsonian Institution, a Fulbright lecturer in South Korea, and elected to the New York Academy of History. His books include Crossing Broadway, Washington Heights, and the Promise of New York, Transit Talk, New York's Bus and Subway Workers Tell Their Story, and the recently published When the City Stopped, Stories from New York's Essential Workers, the topic of today's Lunch and Learn. Robert has also written for the New York Times, the Daily News, and the Washington Post. And now I'll turn it over to Rob to begin.
When the City Stopped, Stories from New York's Essential Workers is embedded in the tremendous work of historians, archivists, and folklorists who recognize the importance of the pandemic and work to record its history in New York City. I drew on their interviews and collections in compiling this book. The book's also the product of the memories, stories, and poetry related by people who suffered, coped, and worked during the COVID-19 pandemic. Central to this book is oral history, recorded interviews conducted to give the person speaking the opportunity to present their version of their own history, their memories, their thoughts, their stories on their own terms and in their own way. This is very different from a television news interview where you stick a microphone in the face of someone who just survived a car crash and say, "What was going through your mind when your car went off a cliff?" The oral history interview lets people tell their own version of events at length, and I'm really grateful to have had the opportunity to draw on these interviews that so many folks conducted in this book. I also realized after I finished this book that the book is embedded in my own life and work. I first studied oral history with Al Howard at Livingston College in Rutgers in 1974, and I also studied with Ron Greeley at grad school at NYU in 1981. I've worked with oral history as a historian and a journalist with a special interest in New York City because I'm committed to sharing history with the broadest possible public. When COVID-19 struck New York City early in 2020, I was a newly appointed Manhattan Borough Historian, named to my post by Gail Brewer, who was then the Manhattan Borough President. For all that I knew about Manhattan and New York City, I knew nothing about viruses, about COVID, the history of medicine, or public health. As borough historian, it's my policy to help people when I'm knowledgeable, and when I'm not, I get them to a better source. So when journalists started calling me with questions, I recruited historians who were knowledgeable about the histories of medicine and public health to answer them. I got David Rosner at Columbia University and Janet Golden, who had just retired from Rutgers University, to give me advice and respond to reporters' queries. Janet and David's willingness to share their knowledge inspired me to invite a wider group of historians, folklorists, archivists, and oral historians to gather over Zoom. Our gatherings were completely improvised, but they were guided by the idea that our responses to the pandemic would be better if we worked together and helped each other. In our conversations over the spring of 2020, we tried to make sense of a rapidly unfolding crisis in public health. And as historians, we tried to put the events around us into a historical context. What did they compare to? Were they like anything we'd seen before, or was the pandemic something entirely different? The obvious precedent was the flu epidemic of 1918, a global event that took some 30,000 lives in New York City, 675,000 lives in the United States, and more than 50 million lives worldwide. We were amazed that a global disaster that had all but vanished from public memory was at the same time so huge. Historians wrote about it, But the children and grandchildren of people who endured it, people of my generation, rarely had any knowledge of it. I'm an example. I learned about the 1918 flu epidemic only in college. By the time I was in college, I could tell you all the famous battles of the Civil War, the turning point of World War II, and the history of the Vietnam War. But I knew nothing about the flu epidemic until I interviewed my grandmother for an oral history project. She casually mentioned that something took place after the flu epidemic, and that set off a chain of questions. I learned that the flu in 1918 was a terrible event, and that my grandfather was not shipped to Europe in World War I with the rest of his army outfit because he was so sick with flu that the hospital staff on his base expected him to die. He did not die. He lived. He got home, went back to work in New York City, and he became a transit worker, and that's why I'm here today. Memorials to the soldiers of World War I are all over New York City. You can still find them, but there's no memorial to the people who died of the flu, and there's no memorial to the nurses and doctors who bravely cared for them in that difficult time. I think that loss of public memory of the flu epidemic left New Yorkers less prepared to face the COVID-19 pandemic. But many of us, historians, archivists, folklorists, thought that if we did our work properly, people would remember the pandemic in useful ways. It would not be forgotten. I'll say more about that assumption later. As historians will do, we searched for analogies that would help us clarify our thoughts on the pandemic. Was it comparable to the great cholera epidemics of the 19th century? Was it comparable to tuberculosis? Was it comparable to AIDS? Josh Brown of the American Social History Project hit the mark when he said the pandemic would be as big and significant as the Great Depression of the 1930s. Convinced that we faced a unique crisis of extraordinary importance, we got to work. Historians set up oral history projects all around the city. At Fordham University, students pivoted from interviewing for the Bronx African American Oral History Project to interviewing all kinds of Bronx residents all over that hard-hit borough. They worked over Zoom and conducted some of the earliest interviews about the pandemic in the entire city. Their interviews recorded the voices of people like Sheikh Musa Drama, who shepherded a community of West African Muslim immigrants through the pandemic. The Columbia Center for Oral History Research built on the long presence of oral history at that university and earlier work they'd done after the terrorist attacks of September 11th, 2001. They compiled a large array of interviews with healthcare professionals, including the EMT Phil Suarez, who recounted how on his worst day, he had to deal with 4 people who all had heart attacks on one of his shifts. At the College of Staten Island, students recorded interviews with people all around what sometimes gets called the Forgotten Borough. One of those interviews was with Elizabeth Petrillo, a cashier in a supermarket. During the long weeks and months of lockdown, she served as an amateur therapist for customers starved for human company who passed through her checkout counter. Queens Memory Project, which was already documenting individual life stories of life in Queens, turned to recording Queens' lives in the pandemic. One of the people who recorded for them was Elizabeth Chu, who tended to gravely ill patients during the day in Manhattan and went home at night to post videos to her fellow nurses online, preparing them for the hardships they would face at work the next day. Archivists at Brooklyn College started a local branch of a global project, Journal of the Plague Year, to collect online the writing, images, art, and media that expressed Brooklyn responses to the pandemic. One was an article by the professor and librarian Beth Evans, who wrote an essay about the trials of helping students over the internet and losing a valued colleague to COVID. The folklorists at City Law collected poems, writings, and photographs, including an essay by Sumaya Abida, the daughter of Bengali immigrants in the Bronx, who turned to prayer when her mother faced infection as she worked in a hospital as a nurse. At Pace High School on the Lower East Side of Manhattan, David Rolfing's English students put together a lexicon of the pandemic, a dictionary of words and phrases inspired by the COVID-19 experience, like COVIDiot, a person who doesn't wear their mask and doesn't social distance or follow simple COVID-19 protocols, as in, don't be a COVIDiot, stay at home if you feel sick. Where there were holes in the coverage, I filled them with my own interviews with people like Robert Kelly, a transit union officer who lingered for days between life and death in a Bronx hospital, and Veronica Fletcher, the widow of the transit worker Joseph Fletcher, who died of COVID. We learned in all these interviews that people were coping with terrible feelings of isolation. They were scared. They ran terrible risks. Many people needed to work to support their families, but if they caught the virus on the job and brought it home, they might infect their loved ones. People compared the pandemic to other disasters, most commonly 9/11. Most thought COVID was worse because it killed more people and lasted longer. People were angry, and many of them expressed thoughts that New York City was being abandoned by the Trump administration. People often hoped for some kind of better future after we passed through the pandemic. They hoped to live in a city whole and healed. But as we accumulated recordings, photographs, and more, we began to confront the big question: what do we do with all this stuff? For a while, we contemplated creating a big digital repository online, like one we created to record reactions to the terrorist attacks of September 11th, 2001. That big digital archive is now available still through the Library of Congress. But that seemed like too big a job and too expensive a job. We settled for organizing archival homes for the materials we collected in our home institutions. So you can now find great material online through Columbia University, Brooklyn College, Fordham, the Queen's Memory Project, and the College of Staten Island. It's not all under one roof, but it's available for future generations to study and explore. And I think there's a lot of good research that will be done that way. But where did that leave me? I didn't want to become a web designer, and I didn't want to become a fundraiser to pay for someone else's website. But long before the pandemic, in my daydreams, I thought that if I had lived in the Great Depression, I would have somehow found myself a place in the Federal Writers Project. The Federal Writers Project was one of several efforts under Franklin Roosevelt's New Deal to simultaneously promote the New Deal's good works and knit people together, to spotlight sources of American strength and help people meet the crisis of the Depression. The Writers Project did inspiring work. They compiled city, state, and regional guides. They conducted oral histories with formerly enslaved people from the Old South. The Writers Project left a great record of what it was like to live through the Great Depression for future generations. It launched great careers among writers, artists, and others. And its democratic spirit, looking at the lives of ordinary people and recording history from the bottom up, inspired people like the oral historian Studs Terkel. In the 1970s, Studs published the book Hard Times, an oral history of the Great Depression. I first read it in a college oral history course. I'd also encountered in my college years a book by the great French historian Marc Bloch called Strange Defeat. As a historian, Bloch was famous for his writings on medieval history. He helped found a school of French historians called the Annales School that stressed studying long periods of social history, environmental history, and regional history. But Bloch had also been a soldier in the French army in 1940, and he experienced firsthand Nazi Germany's defeat of France. Bloch did not take defeat easily, so even though he was in his 50s, he became an active member of the French resistance. He also wrote a book, Strange Defeat, to explain how France was victorious in World War I, but quickly defeated in World War II. He traced his country's collapse to political divisions between left and right, and hoped for a future where French people would be devoted to France as both a nation and a republic. Frankly, I was inspired by both the Federal Writers Project and Marc Bloch's Strange Defeat. The difficulty of the COVID experience in New York City was astonishing to me. We are a city with world-famous hospitals and a famous commitment to public health. How is it that a city that was so seemingly well prepared to face something like COVID-19 struggled so mightily with it? And as for the Federal Writers Project, I thought that We were in a moment very comparable to the Great Depression of the 1930s. Americans were scared, they were divided, they needed to identify something about their own time, their past, and their present to cope with it better. So I set out to write a book that would help future generations understand the ordeal of the pandemic and how we got through it, in the words of the people who lived it. There was no single common experience of the pandemic. We all experienced it in many different ways. Some people left the city for country houses. Some people huddled in the back of their apartments, like me, and other people went out and worked as essential workers. As one of my grad school mentors, Tom Bender, observed, if New York is ever going to forge some kind of collective response to COVID, people will have to gain a better understanding of what other New Yorkers endured. They'd have to enlarge their stock of empathy and apply it to understanding people who survived COVID in very different ways. Now, I didn't want to write a total history of the pandemic. I think it was too soon to do that. We're frankly still in the aftershocks of the pandemic. It's not entirely over for some people. And I also felt that it was too early to gauge the impact of COVID on our city and our country. I also felt that I didn't know enough about medicine and public health to do a good job. But I do know a lot about the city. I do know a lot about oral history. And I think I can tell a good interview from a poor one. And I had lots of good interviews to work with. So with the help of two interns, Gracia Brown and Brendan Reynolds, I dug into more than 400 interviews, poems, journals, and first-person narratives. What experiences would we uncover? What concerns would we see? After months of reading, I noticed recurring themes in the interviews: coping, suffering, and working. But the ways of coping and suffering and working varied immensely across the city. Some coped by leaving the city for the relative safety of country homes. Others coped by isolating themselves in their apartments. Others, essential workers, went out to do essential jobs and then scrubbed themselves clean in an effort to expel the virus from their bodies before they came home. Suffering varied too. Some people were terribly lonely. Others were frightened. Others coped with tragic losses, the death of loved ones, or the death of a patient they tended to in a hospital bed. Middle-class people with white-collar jobs like me worked from home, using computers and telephones. Working-class people often labored in frontline positions as transit workers, hospital workers, supermarket cashiers, or food delivery workers. They faced infection and death as they went about their daily jobs. I could reprint only a small percentage, maybe 10% of what we looked at. But that relatively small selection had to be coherent. The interviews had to hang together. I thought hard about what I'd read. I wrote multiple drafts of an introduction to the book, and my readers told me more than once, you have to write a new introduction. The first drafts just didn't work out. To do justice to all the different voices in my book, I muted my own voice so that the interviews, poems, and narratives in the book would stand out. And eventually I found a framework that seemed to work. I would publish interviews that dealt with coping, suffering, and working, and I would put interviews with essential workers at the center of the book, because their labor at terrible cost sustained the city over months of hard times. They faced death and sometimes died so that the rest of us might live. Just 5 years after COVID-19 struck New York City, we've almost forgotten the early days of the pandemic in the spring of 2020, when refrigerator trucks were filled with dead bodies and 800 people were dying a day from COVID-19. We may remember the lockdowns and disputes over masking and vaccines that persist to this day, but we fail to remember what actually kept the city running and helped it survive: the labor of essential workers in our hospitals, grocery stores, transit system, police precincts, and firehouses. And the desire to forget the pandemic is perfectly human, but to forget the labor that saved the city would be a dangerous mistake. In a world where the avian flu hovers near us, where measles is reemerging and viruses are mutating daily, we need the example of essential workers' courage and solidarity to strengthen us for the next public health emergency. When Governor Andrew Cuomo's New York on Pause plan took effect on March 22nd, it divided New York State's workforce into essential workers who were expected to go out and do their jobs, and the rest of us who could labor from home. In an age when so much of reality is understood as virtual, essential workers faced actual hardships in the streets, in subways, in stores, and in hospitals. Their work affirmed a point made by the literary critic Paul Fussell, who said that there are only two classes of people: those who might get hurt or killed on the job and those who won't. The pandemic dramatically expanded the number of jobs that carried a mortal risk, then doubled the inequality by disproportionately claiming the lives of Black and Brown New Yorkers. Faced with such dangers, more than 45,000 New Yorkers and more than 1 million Americans died of COVID-19 from 2020 to 2023. People who worked under the threat of COVID were sustained by many different beliefs and values. For some essential workers, above all police and firefighters, facing danger is part of the job. And transit workers toil in a system of buses, subways, and repair yards where hazards are common. Others face danger on their jobs for the first time. Healthcare professionals expect to confront dangerous illnesses, but the communicability of COVID-19 was unusual. Cashiers in supermarkets and drugstores were surprised to find themselves facing a deadly disease transmitted by their customers. It was a scary time. Police officers, firefighters, paramedics, and emergency medical technicians went into the homes of the sick to provide support, care, and when all else failed, transportation to a hospital. Nurses learned new skills overnight to meet the demands of COVID-19, then held cell phones next to their dying patients so they could hear the voices of their loved ones. Doctors improvised new forms of communication and treatment. Cashiers and food service workers provided meals and emotional support for customers. For all their bravery, many essential workers faced terrible working conditions. Bicycle couriers who delivered meals for restaurants confronted poor pay, bad weather, and the galling fact that the restaurants they served would not let them use their toilets. Healthcare professionals grappled with shortages of protective gear and medical supplies. Transit workers had to deal with passengers who ignored rules on social distancing. I interviewed a bus driver who was knocked unconscious by a passenger after he asked the man to put a mask on to cover his chronic cough. Still, for a time, the city seemed united. Every night at 7 p.m., New Yorkers leaned from their windows or stood on the sidewalk to cheer their essential workers. For precious minutes, we broke out of our isolation, saluted the best in us, and strengthened each other. Working together, putting the common good first, the city managed to bend the curve. Stay-at-home orders, social distancing, and masking brought the numbers of the infections down. By June, the COVID surge of spring 2020 was over, and deaths were down to a much reduced level of less than 50 a day. But the spirit of solidarity proved short-lived. Ironically, after vaccines against COVID-19 were introduced in December 20 and the danger eased, the city was gripped by a sour mood, starting with negative reactions to a computerized system of registration for vaccines that was glitchy and inefficient. Restaurant operators had to contend with both changing municipal guidelines and customers who flouted masking requirements. Old currents of hatred, especially anti-Semitism and racism against Asians, gained new strength. Over time, the value of the vaccines themselves became a subject of debate and disinformation. One of the great lessons of the pandemic is that solidarity is hard to maintain. When the interest of public health and personal interest aligned, as they did in the spring of 2020, people were willing to wear masks and engage in social distancing to save themselves. Once the vaccines made them feel safe, they were reluctant to accept limitations on their individual lives. Maintaining public health requires setting aside private interests to serve the public good. When a communicable disease attacks, it becomes clear that the health of each of us is bound up with the health of all of us. In the grim days of the pandemic, essential workers were their brothers and sisters' keepers. For all the divisions in our city and country over the pandemic and so much else, the courage of essential workers is something we all can admire. We need to learn from it if we are to build a better future. What I'd like to do now is just read excerpts from a few of the interviews that are compiled in the book. I'd like to begin with one from Reagan Wheel. She's a bus operator. She grew up in Manhattan on the Lower East Side. African American, comes from a family of transit workers. I interviewed her for this book, and here's what she had to say about driving a bus during the pandemic. There was no traffic. We weren't picking up people. I've never seen Times Square so empty. I mean, when I say empty, there were no parked cars at all. We still had to stay on schedule. A lot of us had to park our buses and wait before we could go to the next time point. We still couldn't be ahead of schedule. We didn't really have a lot of passengers, but when we did, sometimes it was a challenge to get them to keep their mask on. You would have some people coughing and sneezing, and that worried us. Most cooperated, but some didn't. If someone didn't cooperate, we would call it in because we didn't feel safe. They would send a supervisor to us, or sometimes we could put the bus out of service because it just wasn't safe for anyone if someone refuses to wear a mask. I had a man who came through the back door, sat in the back, and he was just hacking. He refused to put on a mask. The passengers asked him. I asked him. So I had to call it in. A supervisor came, put him off the bus. We would pick up the homeless when Port Authority kicked the homeless out. They had nowhere to go, and at that time it was still a little chilly. So they would come on the bus, which was kind of unsafe for us now because you have the mentally challenged there as well. You have people you don't know, and you can't predict what they're going to do. I had one guy who made me nervous because he would just stand there and stare at me in the mirror, and he made me nervous to the point where I called it in. I didn't know what he was capable of. I didn't know what he was going to do, and I wasn't risking it, so I called it in. What you have to remember is that there wasn't really a lot of people on the bus at that time. It was just him and I wasn't taking the chance. So I asked for assistance. We had a lot of people die from COVID-19, which was very sad. We, transit workers, were the city agency with the most deaths. I knew a few people who died, and it was shocking. It was disturbing the way it just came in and wiped out workers throughout the system. A lot of us were angry. We were frontline workers. We were essential, but people didn't really consider us essential. We didn't matter. Another interview to read from is with Beth Evans. Beth Evans is a librarian and a professor at Brooklyn College. And during lockdown, she helped students do their research over the internet. So she was working full time, even though she was quarantined in her home with her family members. She wrote, before the spring lockdowns had even ended, 3 faculty and 2 staff at Brooklyn College died of coronavirus. All were loved by someone or other. I am sure those who loved them were ordinary people for the most part. I knew the 2 office staff who died, one briefly because of work I did on a search committee at the college, and the other because our lives intersected at many points. Jay was a man who delighted in meeting people, remembered everyone he met, checked in with everyone regularly, and died too young at 31. He overlapped with one of my daughters during their high school years, walked into the Brooklyn College Library as an undergraduate interested in exploring the possibility of a career as a librarian, and showed up frequently in an office in Boylan Hall when I had accepted a part-time position across campus as a dean's faculty fellow. Jay sent me one of his typical thoughtful and engagingly written periodic emails near the start of the pandemic, about a week after the campus had moved to online instruction, and 2 days after the governor called for a statewide pause in all business operations. But at this point in our lives, Jay had gotten comfortable enough to call me by my first name, though I still have a cache of his emails that address me as Professor Evans. He was concerned that I had stocked up on the essentials during these crazy times, and wrote back to him that I look forward to seeing him on the other end of this. No, Jay, regrettably, I will not see you on the other end of this. Neither is any of us sure when we will come to an end of this. Jay seems to have had a very long list of folks with whom he took the time to check in on regularly. A colleague commented to me that learning more about Jay after his death had left her with the surprised feeling one would have who suddenly discovered that her loving husband had dozens of other wives. She was stunned at first, even hurt. I thought I was his special one, she said. She quickly came to realize, of course, that someone as thoughtful as Jay could only be someone who showed thoughtfulness for everyone he met. And just a third one now about a woman who made masks. Lily Chin lives in Greenwich Village. She's a knit and crochet designer. But in the spring of 2020, she was jolted into making masks by a shortage of masks in New York City. She writes, I knew several friends, associates who died of COVID. Others survived but still live with the medical consequences, like needing a walker and still requiring an oxygen mask. 10 blocks from me, a major health facility had the dreaded and necessary refrigerated trucks for the bodies. I'd pass by it on evening walks and veer away. I have good friends and family who are doctors and nurses. My cousin and her husband are both healthcare providers, and they quit so as not to leave their children orphaned should both of them fall to the disease. It's not hyperbole to say I felt scared and helpless. I felt the need to do something, but didn't know what. Masks were scarce. The N95s were discouraged for civilians, as even the health pros didn't have enough. But production for masks for everyone else had not ramped up yet. Thus, those with do-it-yourself skills were at an advantage. I joined groups online about mask making as my seamstress skills are woefully lacking. I had a real sewing machine that saw very little action, as well as a couple of toys, plastic jobbies, that did rudimentary stuff. I printed out scads of models from the standard surgical to my favorite, the duckbill. However, as a person with a science background, chem major in college, pre-made track, I knew that cloth, even doubled, has its limitations. So off I went into the rabbit hole of do-it-yourself science groups, doing everything from mechanizing manual ventilators to jerry-built shields with 3D printing. I found that surgical wrapping material for sterilizing instruments in hospitals, when doubled, has an extraordinary efficacy, on par with N95s. I got my wonderful dentist to use his dental license to order some up from a medical supply company. I also found filters, blue shop towels, and other highly effective alternatives. In a nutshell, much better than the standard woven fabrics. Now for the making. I sewed and sewed until my real machines broke down. I went to both my toy alternatives until they broke down. None of the repair shops here in New York were open, as they were deemed non-essential workers. I resorted to sewing by hand. I ran out of elastic and found elastic online was as scarce as flour and sourdough starters. I took some off old underwear. I cut up old t-shirts. I even used Cascade Yarns fixation cotton with spandex, whatever it took. I made more than 500 masks and gave them away for free to local hospitals and hospital workers, the essential workers, the homeless out in the street, friends and neighbors. I just wanted everyone around me to be safe. Selfishly, I wanted everyone around me to be less infectious. We're in a much better place now. New York's positivity rate is less than 0.5%. We're close to 70% vaccinated. I've yet to get my sewing machines fixed, but I intend to do so soon. Happy to take questions now about the project, what we learned, and what you might think we should remember about those times.
Thank you so much for all of that.
Thank you.
Yeah, and please add your questions to the bottom of the Q&A tab there at the bottom of the screen. We do have some that have come in. So one asks that you mentioned transit workers a few times. Were they the most affected workforce? And
yeah. Among municipal workers, they were the most affected. The last time I looked, more than 130 had died, and it was terrible. Early on in the pandemic, transit workers went to the transit authority and said, something's coming. We've got to get on top of this. And the transit authority at first was slow, and the death toll went up and up and up. And eventually, the transit authority instituted social distancing, let people wear masks. You can find online a very moving web memorial to all the transit workers who died. It's really sobering to look at all those photographs and all those biographies. The Transit Authority also commissioned a beautiful poem about the transit workers who died, but they were the municipal workforce who died in greatest number. And it's amazing to me how invisible they are in people's everyday lives, even though the subways and buses are what keep the city running. And they paid tremendous sacrifices and losses during the pandemic.
Do you know if they ever did get the hazard pay that they duly
I
deserved?
think so, but I think so, yeah. But the losses were really beyond everybody else, you know.
Thank you for that. Did historians or others in any other cities or places do similar collection of contemporary interviews, et cetera, on experiences?
Yes, there were lots. So there was a program called Journal of the Plague Year that's really international, and that allowed colleges, universities, and other folks all around the world to contribute to a web-based archive, right? That was very individuated by institution and city, but also drew things together from all around the world. The Smithsonian was collecting early on as well. There was a terrific book published by this State University of New York Press about the pandemic at SUNY Oneonta. So in one school, faculty and staff recorded observations of students, professors, staffers about what it was like to go through the pandemic. And because SUNY Oneonta has strong connections with New York City, a lot of our students go up there, you get a sense of the statewide impact of the pandemic. The Vermont Historical Society also did an oral history project, and I just got a copy of the book that they published based on their experiences. So people were aware that this was big, and they also, I think, responded accordingly, and that's something that I think is admirable in many different places, in many different cases.
Oh, that is really interesting. Do you know if there's ever any, I mean, it's obviously just becoming enough time to really look back and compare, but if there's ever any comparative looks that are being done?
I hope that in the future we do two things. One is interviews with people who were COVID skeptics or who were reluctant to get vaccinated. We need to understand what they thought and why. I think it's really, really important. The second thing is I hope we do interview with folks decades out after this experience. If you were a young person going to elementary school in the pandemic, what did it mean over the course of your life? If you're an older person going through the pandemic, what did it mean for the rest of your life? I think that figuring this out is going to be very, very important to understanding the full impact of this episode in the future.
In your opinion, what are the measures that can be implemented to ensure that people would consider prioritizing public health over private events? As mentioned,
how we do this is really hard because I think that one of the things that you see in the pandemic is that it accelerated trends that were underway already, right? The Americans at the middle of the 20th century in many ways had more in common, felt they had more in common with each other, felt they had more reason to trust each other, felt they had more reason to trust public institutions than the Americans of the 21st century. In general, a decline in institutions and a polarization among Americans is, I think, one of the hallmarks of the last 25 years or so. So all of those left people feeling quite divided when the pandemic hit. And I think the pandemic accelerated those trends. So they're not traceable to any one factor, but multiple factors that created a kind of tsunami. What Americans did most well in the pandemic is bond together in small groups, family members, neighbors, co-workers. They did that on a small scale, but it's really instructive to see how they do it. The challenge is scaling that up for the future, and that's going to take a massive effort in all sorts of ways. And it's going to involve public health, but many things beyond public health. So it's a big job that we had ahead of us.
I can believe that. One question here says that you mentioned school students. I definitely heard that a lot. But did your research include New York City public school teachers and other employees?
Yeah, we have an interview with a school teacher in the book, Damien Larocque, who taught in Queens, and a part of Queens that was very hard hit by the pandemic. And he talks about a couple of things. One was, by the winter, by February, you knew that something was coming, right? And he was trying to find ways to talk to his students who were, I'm pretty sure, elementary school students, how to talk to them without scaring them, but still being honest with them. Once the pandemic hit and he had to teach virtually, he faced two challenges. One was teaching online, which was not easy. A lot of the students lived in crowded homes where it was very difficult to carve out time, to take classes with any degree of concentration. The other was a lot of his students, had trouble with getting adequate clothing, had trouble with getting enough food. So he found himself working on food, clothing, emotional support for kids who suffered deaths in or near their families. And it was a very trying time.
What is the most significant lesson that we should take with us into the next serious health or environmental crisis?
I am not an expert on public health. I want to make that very clear. But the thing that's came through strongest to me is that in a pandemic like this, the health of each of us is tied up with the health of all of us. And you have to think about yourself. You have to think about how your actions affect your neighbor and other people around you. This is a hard one for a lot of people. I think most of our lives are set up so you don't have to do that. And I think we have to think really long and hard about consequences and responsibilities in emergencies like this.
Well, I know early on in your talk today, you mentioned a name of a book by a French writer along with the writer's name. Can you repeat that?
Book. Yeah, sure. The book is called Strange Defeat by Marc Bloch. And, Marc Bloch is one of my personal heroes. And he wrote this book in the aftermath of a catastrophe because he was smart enough and brave enough to try to figure out that we must face this catastrophe and see why it happened as quickly as possible so we can undo it. And I think the book is still a fascinating read. And his life and frankly, his death are really quite heroic. He was in the French Resistance when he was in his 50s. And he was eventually betrayed, tortured, and executed by the Nazis. And he left quite a testament for us.
I'll have to add that to my library list. Many other countries did not shut down their entire societies, but also did not suffer consequences as serious as we did. So what do you think made the difference?
I'm not going to pronounce on individual strategies. I'm not an expert on that. I mean, I have thoughts on them, but they're relatively uninformed. I think discussions of the pandemic have been loaded with people who speak way beyond their expertise. I mean, the one fact is our death rate in the United States was higher than a lot of other countries, and that's a spooky thing to look at.
Yeah, agreed in full. Well, in your interviews, did you also interview staff from any of the hardest hit New York City public hospitals?
Did we have a public? We had interviews with a lot of staffers at New York Presbyterian who were certainly working under very, very difficult circumstances. I did an interview with a transit workers union official, a guy from Local 100, an officer there, Robert Kelly, who I didn't take the name of the hospital he went into, but he lingered between life and death for several days. So I think the book gives you a pretty good idea of what it was like to be in extreme conditions. It's not a representative microcosm of New York City in the pandemic. A book that big would be, as big as an old Sears Roebuck catalog. But what it does is it gets you the experience of what it was like to be a nurse, what it was like to be a doctor, what it was like to be an EMT under grave conditions, under high pressure.
I can imagine. And I feel like that comes up in those themes that you mentioned earlier about coping, suffering, and working. And I can see how those themes are very relevant in those kinds of work right there.
One of the things I'll say, and this was a fascinating realization for me. My wife asked me relatively late in the book, does it have an impact on you that you spend all your days in the dark back room of our apartment editing oral history interviews where it's always the spring of 2020? And I thought, well, thank you for asking. And I still don't know the full impact of it on me, but what I'll say is this. It was the interviews conducted about the spring of 2020 that were the most inspiring. They were about people being brave. They were about people sort of putting the common good first in very difficult situations. They were about people reinventing their jobs. Doctors and nurses were inventing whole new ways to care for people to keep them alive in the face of terrible shortages of gear and supplies. I thought those interviews in particular were particularly uplifting in ways that I had never imagined.
Was there a particular story or interview that really stood out to you as just being just that, I guess, like I would say the most inspiring or the most memorable for those reasons?
I can't say one. Let me read a piece of one, okay? Because this is somebody who really did something amazing. Hang on a second. I've read it before and I find myself reading it again because I think it has a lot to teach us. If you'll give me 1 second. Patricia Chu was a nurse who worked at New York Presbyterian in Manhattan on the East Side. And she reflected on her time as a nurse during the hardest days of the pandemic. And what she would do was tend to patients during the day, sometimes keeping them alive, sometimes comforting them as they died. Then she'd go home at night and make homemade videos to other nurses and post them online so they'd know what they were going to face when they went to work the next day. And here's just a few paragraphs where she reminisces about that time. The nurses that I work with every day, I'm extremely proud of them. Everyone stepped up. Every single one of those nurses took initiative and didn't say no. It made me so proud to be a nurse. Our nurses acted as not just registered nurses, they acted as doctors, they acted as respiratory therapists, they acted as nursing assistants, they acted like the cleaning services. We emptied out our own garbage, we cleaned our own floors. Nurses and medical staff are really superheroes. I'm genuinely proud of all the nurses that have stepped up during this time because it was not easy. They really did the impossible. The clapping at 7 really made me feel good. You may have a nurse who had such a crappy shift, patients might have died on their shift, and as they're walking out, they hear somebody cheering. It makes a difference. It uplifts the spirit. She is actually today doing a residency in San Antonio, Texas. She anticipates a career as a psychiatric nurse. She's wrapping up her education at Hunter College, and some of her friends have suggested she should run for Congress.
Fantastic. Thank you for sharing her story.
Sure.
Just out of curiosity, are you still in contact with
Yes,
a good number of these people?
And the interesting thing was, because of social distancing, I did so much of this online and over Zoom. So I never met the people whose interviews I was editing. And in editing interviews, you feel like you get to know people so well. I mean, I'd occasionally talk with them on the phone, but I'd spend hours editing, and how people speak, what they recall, how they recall it is tremendously revealing. But rarely, I think maybe only 1-2 people did I meet face to face. So when some of them showed up at the launch last night at the CUNY Graduate Center, it was tremendously moving for me to meet them. I was so thrilled. Some of them looked like what I imagined they looked like. Others looked completely different. And it was such a wonderful surprise and really gratifying to see that.
The first you're actually getting to see them,
exactly,
meet them in person.
Exactly.
That's fantastic. Well, another question here. Did you interview parks workers as well for this?
Irony is no, and not for lack of trying. I did want to interview parks workers. The Parks Department did their own oral history project. It was taking place while I was doing my work. So when I didn't have time to get an interview, I said, I'd like to run a photograph of parks employees. They said, oh, we have lots. The press office sent me like a dozen photographs. And there was one that was really good. It showed parks workers distributing food to people who needed food, doing it out of a parks facility. But the Parks Department, for reasons which I cannot fathom, would not give me permission to produce that photo in my book. They sat on it. They stonewalled. There's no other word for it. They finally put me in touch with a member of the legal staff. I had to talk to a lawyer. I explained that, the purposes of this book being published by Cornell University Press, they never gave me permission. So Parks Department, in the future, if you have a great story like this, tell it. Don't hide it, okay? I'll say also, I tried to interview one police officer. She wanted to talk to me. The department would not let her. They just ignored my request. I eventually interviewed a retired police officer who stepped down and retired in June of 2020. It was a wonderful interview, really edifying. You learned a lot. But when institutions get away of letting their people talk, it's not always a good thing. It's usually a bad thing.
Yeah, well, something like this, I think, would be a great way to just saying it, get our agency names out there.
Yeah. I'll say this. I mean, in praise of the police officer I interviewed, is a precinct commander in the Bronx named Richard Brea. And he talked about how scary it was for police officers to get a 911 call to go to a house where someone was sick or dying with COVID. And sometimes officers wouldn't want to go in. And it was understandable. Nobody knew how infectious it was. Nobody knew what it would do to you. And he said he gave them a speech. He said, this is no different than a gun job. This is no different than a burglary in progress. When we became police officers, we swore an oath to protect the public. We have to go. He put a mask on, he led the way, and he showed them how to do it. And they followed up. And I think it's a great example of good leadership and good practices.
Has there been research, and I feel like this could go a lot of ways here, but has there been research on the effects of isolation on the health of different age groups and on different populations?
There probably has been, but I just don't know it myself. What I studied most was the interviews and the lives of the immediate context of the people in the interviews. But I think it's fairly clear that the impact was serious. There were lots and lots of interviews where people talked about isolation. In fact, the Columbia Project has lots to say about this in its own interviews. And often interviewers who worked over Zoom, right, doing their interviews, were very much aware that they were as much like counselors to the people they interviewed as anything else, that they helped break the isolation. And among essential workers, I mean, a couple of people said this, that when they delivered food or where they checked somebody out of a cash register, they were like the only emotional contact that person had had all week. And that it was a big challenge. It was a big burden, but I think they met it as best they could.
Yeah. I mean, I remember that time, and it was a lot. It was, I mean, these kind of video connections and over Zoom and just being outside. Anybody you saw, it was a lot.
Yep.
Well, that's all the questions that we have right now. But thank you for all of this and for everything that you shared.
Can I read one more interview? Because I think it's actually not an interview.
Sure.
Poem, and I do want to stress, as awful as this experience was, there were episodes in it. There were examples of great behavior that I think we can learn from. And this is from a poem by Ron Colm. Ron is a poet. He's lived in Long Island City for a long time. He had a 50-year career in bookstores that came to an end during the pandemic. So one day he was on unemployment. He took a subway into Manhattan, and the experience inspired this poem. I had to travel into Manhattan to cash my unemployment check. So I sat in the front car, wearing a mask, doing my best to avoid the other passengers. After leaving the bank, I walked back to Union Square Station and found a place on the platform where there weren't too many people standing around waiting. Time goes by and no train appears. There's a sudden movement as a woman, maybe late 50s, tosses her bag and her mask onto the tracks, then clumsily climbs down and joins them. "Hey, what's up?" I shout through my mask. She moans and says that this is how she's going to get home. She's tired of everything. She edges over toward the third rail. And unfortunately, because my back is so messed up, I can't physically grab her. So I unleash my best zinger. Do you believe in any kind of God? Because if you do, you got to know how pissed off he or she is going to be if you touch that thing. A young guy comes running over, jumps onto the tracks, and lifts the lady up, depositing her on the platform. He holds her, waiting for the police, who do show up pretty quickly. My train finally arrives, and I go home, amazed at how the universe works.
Thank you for that.
Thank you. Thank you for this opportunity.
This has been amazing today. Monica, you have anything else to add?
All right. So thank you, Robert, for joining us today to share stories of the essential workers that kept New York City running during the COVID-19 pandemic and the work that has been done to preserve their stories. If you're interested in purchasing When the City Stops, please click on the link posted in the chat and be sure to use the promo code 09BCARD to receive 30% off on your purchase. Thank you to everyone who attended today's program, and we hope to see you on Tuesday, April 8th for our next Lunch and Learn, America's Street of Dreams with Dr. Mosette Broderick. So hope to see you there, everyone. Have a good one.